Are you ready to learn how to keep your bones strong as you age and prevent osteoporosis? If you're over the age of 50, then this is especially important for you to pay attention to. Osteoporosis, a condition that causes bones to become weak and brittle, is a common concern as we get older. But the good news is, there are things you can do to keep your bones strong and healthy throughout your lifetime. In this video, we'll go over the causes of osteoporosis, the symptoms to look out for, and most importantly, the steps you can take to prevent it. Welcome to our channel. If you're new here, make sure to subscribe and turn on notifications so you don't miss out on any new videos like this one. We also encourage you to like and leave a comment in the section below if you have any thoughts or contributions to share. Now, let's get into the video. First, let's talk about what causes osteoporosis. Our bones are constantly renewing themselves. Old bone tissue is replaced with new bone tissue. But as we age, our bodies produce less new bone tissue, and the old bone tissue is not replaced as quickly. This can lead to a decrease in bone density and an increased risk of osteoporosis. Certain factors can increase your risk of developing osteoporosis. These include being female, being over the age of 50, having a family history of osteoporosis, having a small thin frame, and not getting enough calcium and vitamin D. Now, let's talk about the symptoms of osteoporosis. Many people with osteoporosis don't experience any symptoms until they have a fracture, often from a minor fall. But there are some signs to look out for, such as a loss of height, a hunched posture, and bone pain. But why is it so important to prevent osteoporosis? For starters, osteoporosis can cause serious health problems, including disability, pain, and an increased risk of falls and fractures. In severe cases, it can even lead to a loss of independence. But the good news is that there are steps you can take to prevent osteoporosis and maintain strong bones as you age. By taking care of your bone health now, you can reduce your risk of osteoporosis and enjoy a healthier and more active lifestyle as you get older. So what factors can impact your bone health and increase your risk of osteoporosis? Here are a few key things to consider. Age. As we age, our bones naturally become weaker due to a decrease in bone density. This is especially true for women after menopause. Gender. Yes, women are indeed at an increased risk of developing osteoporosis due to hormonal changes that occur during menopause. During menopause, levels of estrogen, a hormone that helps to maintain bone density, decrease significantly. This can lead to a loss of bone density and an increased risk of osteoporosis. In fact, after menopause, women can lose up to 20% of their bone density within the first 5 to 7 years. Genetics. Yes, it is also true that having a family history of osteoporosis can increase your risk of developing the condition. Osteoporosis is a chronic disease that weakens bones, making them more fragile and prone to fractures. It is caused by a loss of bone density and can be influenced by various factors, including genetics. If your parents or grandparents have had osteoporosis, it is important to be proactive in maintaining bone health. While you may be at an increased risk of developing osteoporosis due to your family history, there are steps we will soon discuss that you can take to reduce your risk and maintain strong bones. Lifestyle factors. For nutrition, smoking, and a sedentary lifestyle can all contribute to weak bones and increase the risk of osteoporosis. For example, a diet low in calcium and vitamin D can lead to weak bones, and smoking can interfere with bone health and increase the risk of fractures. Similarly, a lack of physical activity can weaken bones and decrease bone density. By understanding these factors, you can take steps to improve your bone health and reduce your risk of osteoporosis. Remember, it's never too late to start taking care of your bones, and even small changes can make a big difference in your bone health as you age. If you've enjoyed the video so far, consider giving it a thumbs up and subscribing to our channel. By clicking the red subscribe button and turning on the notification bell, you'll be notified every time we upload a new video. This way, you won't miss out on any of our future content. So, what can you do to prevent osteoporosis? Now that we've discussed the factors that can impact bone health and increase the risk of osteoporosis, let's talk about what you can do to keep your bones strong as you age. Here are a few tips to help you maintain healthy bones. Get enough calcium and vitamin D. These nutrients are essential for bone health. Calcium helps to build and maintain strong bones, while vitamin D helps your body absorb calcium. Good sources of calcium include dairy products, leafy green vegetables, and fortified foods like orange juice and cereals. Vitamin D can be found in fatty fish, eggs, and fortified foods, and it can also be produced by your body when your skin is exposed to sunlight. Exercise regularly. Yes, weight-bearing and resistance exercises can be beneficial for bone health and can help to reduce the risk of falls and fractures. Weight-bearing exercises involve moving against gravity while bearing your body weight, such as walking, jogging, and dancing. These types of exercises can help to stimulate bone growth and increase bone density. Resistance exercises, such as lifting weights or using resistance bands, can also help to strengthen bones and improve muscle strength, which can improve balance and coordination. This can be particularly beneficial for older adults who are at an increased risk of falls and fractures. It is important to find activities that you enjoy and that are appropriate for your fitness level. It is also important to speak with your healthcare provider before starting a new exercise program, particularly if you have any underlying health conditions. Regular physical activity can have numerous health benefits, including supporting bone health and reducing the risk of falls and fractures. Quit smoking. Smoking can hurt bone health and increase the risk of osteoporosis. Osteoporosis, as earlier explained, is a chronic disease that weakens bones, making them more fragile and prone to fractures. It is caused by a loss of bone density and can be influenced by various factors, including lifestyle habits such as smoking. Smoking can interfere with the body's ability to absorb calcium and other nutrients that are essential for bone health. It can also decrease the production of estrogen, a hormone that helps to maintain bone density. As a result, smokers may have lower bone density and an increased risk of osteoporosis. Quitting smoking can help to improve bone health and reduce the risk of osteoporosis. It can also have numerous other health benefits, such as reducing the risk of heart disease, lung cancer, and other serious health conditions. If you smoke, it is important to consider quitting for the sake of your bone health and overall well-being. Consider medication. If you're at high risk for osteoporosis, your doctor may recommend medications to help strengthen bones. These medications work by increasing bone density and reducing the risk of fractures. It's important to discuss the benefits and potential side effects of these medications with your doctor. By following these tips and taking steps to improve your bone health, you can reduce your risk of osteoporosis and maintain strong bones as you age. Remember, it's never too late to start taking care of your bones, and even small changes can make a big difference in your bone health and overall health. In conclusion, while osteoporosis is a common concern as we age, there are steps you can take to prevent it and keep your bones strong and healthy. Make sure you're getting enough calcium and vitamin D, stay active, limit your alcohol intake and smoking, get enough sleep, and talk to your doctor about medications if needed. By taking these steps, you can help to keep your bones strong and prevent osteoporosis. We hope you enjoyed it, and if you did, be sure to give this video a thumbs up and subscribe to our channel for more health and wellness related content. Thanks for watching, and we'll see you in the next one.